Good evening, everyone, or should I say hello to anyone watching this later. This stream is going to be about side effects. It's just something that's been on my mind recently, and that's side effects of conventional pharmaceutical medications and treatments, over-the-counter drugs, supplements, and of course, herbal medicines as well, because I'm a herbalist. So before I get into it, the usual disclaimer. This video will be for information and education and all of that, but I'm not going to be able to prescribe or recommend anything in this video. If you have any medical issues, please go and see your registered medical herbalist or your doctor and get treated for those specifically. This is the internet. So with that aside, I am going to get into it. So I thought I've done a little bit of research for this. So as usual, I've put any links in the description box below this video on YouTube. And I really was just wanting to look into, I have lots of thoughts about side effects, which I'll go into in a minute. But I just wanted to do a little bit of a preamble about what side effects are. And I've linked a paper below the video on YouTube, which goes into that, and they've kind of done a little mnemonic A, B, C, D, E, F for different types of side effect, and that stands for augmented, bizarre, continuous, delayed, end of treatment or end of dose, and withdrawal. So I'll go through all of those. The augmented type just means like giving the person too high a dose. It's augmented. The effects of the medicine or drug or treatment are overdone. They're augmented, just means too much. So the dose is wrong, basically. The B type is the bizarre, the unpredictable, the rare side effect, which is anomalous. And that's the one I think which probably worries most healthcare providers, because it's those idiosyncratic reactions. Sometimes people react to a drug in a way, maybe because they are of a specific genotype. Their bodies, their genes means that perhaps they don't produce a particular enzyme in their liver required to break down a particular drug or substance, etc. Or maybe they're allergic to a particular substance in a way that wasn't easily predicted by their medical history. C is continuous use. In other words, you just keep treating somebody for too long. D is a delayed side effect. In other words, it may not be immediately apparent, but it might appear later on. E is end of dose or end of use, and that's withdrawal, and that's very common. And F is failure. The treatment just doesn't work. So all of these side effect types are very common in any form of pharmacological treatment. And I would include herbal medicine in that. Now, I am a herbalist. I do think there are some very material differences between herbal medical treatment and conventional pharmaceutical treatment. And I won't get into all of that because that would be a whole series of videos, but the basic difference is that herbal medicine is intrinsically polypharmaceutical, meaning you're dealing with lots and lots and lots of different compounds in a single plant. Every medicinal plant is essentially a chemical soup. I think that is an advantage, as would most other herbalists, because it means that they're not bashing one button really strongly like a single drug is. They are pushing several different buttons or activating several different receptors simultaneously. So the action of a medicinal plant in the main, speaking generically, is going to be, if used properly, more of an adjuster and a little bit gentler than a drug. On the other hand, a pharmacist would probably prefer a drug because they think, in their way of thinking, the drug's action is more predictable because it is a single substance activating a single receptor and therefore is more trackable. I see their point of view, but I think that medicinal plants have been in use for tens of thousands of years. This isn't an argument from history so much as an argument based on empiricism. In other words, these plants, medicinal plants, have often been selected by humans for medicinal use for in some cases millennia. We have co-evolved with medicinal plants. There are medicinal plant pollens found in Neanderthal grave sites. So that to me is an argument for their empirical utility, and also perhaps an argument for their relative safety, because they've been in use by humans for thousands of years. We have literally evolved with plants. Does that mean, and am I saying that therefore all medicinal plants are intrinsically safe? No, of course not. Anything that is pharmacologically active could potentially be dangerous, just as any form of medicine could potentially be dangerous, because you are affecting the human body, you're interacting with it. That will always carry a measure of risk. So side effects. So just before I get into this, I mean, in general, herbs are a lot safer than pharmaceuticals. In general, there are, of course, exceptions. There are herbs which in the UK we would classify as Schedule 20. These mean herbs that are restricted for use. They're only usable by herbalists, and there are others which are pharmacy-only medicines. These are very poisonous, some of them. So this is generic, but generally speaking, medicinal plants have lower side effect profiles, but as I say, they can cause side effects, just as any active medicine can. Pharmaceutical, I was shocked by this, although not surprised. Shocked, but not surprised. It's linked in one of the papers below that the fifth leading cause of death worldwide is drug side effects. The fifth leading cause of death is what's known as iatrogenic death. So that was shocking to me. So herbs generally are safer, but side effects can occur with any treatment. So just to sort of back that up, in terms of the different types of side effects I just mentioned, I'm going to try and think through them. So which medicinal plants might cause that? So an augmented side effect, which is an effect caused by taking too high a dosage, it would be easy to cause that. I don't think I've seen that in my practice, fortunately, but it is quite easy to do if you overdose on any plant, if you take too high a dosage. I'm sure there have been instances where a client or a patient has taken is a little bit sensitive to something. So we say, let's reduce the dose a bit. So thinking about it, there probably have been minor instances of that. The type B, as I say, that's the type that would keep most therapists up at night, the bizarre type of side effect, the unpredictable. And there have been one or two instances of that in the last 20 years of my practice. One was a client who got dermatitis on their hands. And another was a lady who had this inflammation in her legs triggered by, it turned out, of all things, marshmallow root, which is such a gentle plant. But that's the bizarre type side effect. The continuous use one, I have seen that once or twice. This is usually, and I'll talk about what I think side effects mean in a minute, because that's where, to me, things get interesting. But I'm just adumbrating examples of how even with plant medicine, you can get these so-called side effects happening, as you can with any medicine, as I say. So continuous use, yeah, there've been instances where I've had to change a prescription, which up until that point has been working quite well. And then the person suddenly started feeling sick, or it wasn't working. And there were no physical issues. There was no change in liver function or anything like that on blood tests, but we just had to change the prescription. That happens. The delayed effects, I haven't seen this in my practice, but we know there are some plants, and herbalists are well aware of these, by the way, that may contain compounds that can build up in the body, and therefore you need to use them only for short periods of time. A classic example would be the plants that contain these compounds called pyrrolizidine alkaloids. These are plants like comfrey, one of my favorites, borage. These can be quite useful medicinal plants, but those pyrrolizidines, if they keep being ingested, can build up in the liver, and even years down the line cause liver problems or even cancer if they're stacked up in the body too much. But it's generally thought that short periods of use for a couple of weeks or maybe a month of some of those plants is okay. But again, there's a range of toxicities. Some plants like borage, I would argue, are extremely safe because they contain very low levels of the least toxic pyrrolizidines, whereas others like ragweed, Senecio jacobea, I think is the Latin name, contain very high levels of pyrrolizidines, which are 50 times more toxic than the ones found in borage. So again, this is, for herbalists, this is a know your plants issue. That's a potential one that, you know, touch wood, we haven't seen in practice in herbs prescribed by a herbalist, but do occasionally occur. You read about it very occasionally in the media, as somebody who's perhaps been drinking comfrey tea for years, for example. And then the final one, final two, there's end of dose, which is withdrawal. This is super common. Again, haven't seen it in my practice a lot, but we encounter this in daily life. People stop drinking tea or coffee. Classic end of dose adverse drug reaction, a withdrawal reaction. People have been having a daily cup of tea or coffee, any source of caffeine, and then they stop suddenly. You'll get a withdrawal syndrome, a couple of days or even up to a couple of weeks, and maybe headaches and lethargy and low mood and demotivation. And then finally, we've got the F, the failure of treatment. That does happen occasionally. It's very upsetting when the drugs don't work, but that does happen occasionally. I think that happens to any practitioner in any modality. So I kind of wanted to talk about what side effects are. I mean, in general, it sounds obvious. Oh, well, they're just unwanted effects of drugs or medicines or treatments. Yes, that's true. But I mean, if you think about that, that's literally what they are. It means there's, in a way, there's no such thing as a side effect. There is only the effect of the medicine, or there is only the effect of the drug or of the treatment that is being taken. And by the way, I use the word drug because the word drug originally comes from an Anglo-Saxon word drigan, meaning dried plant material. So as a herbalist, I kind of like to reclaim that word a bit. Just me. But yeah, so the point there is that side effects are just unwanted effects of a drug or medicine or treatment. But there is this other school of thought. I'm sure you guys, listeners, will have heard of this, which is the idea of a healing crisis. The idea that, you know, some people will get horrible side effects, and actually it's not an issue. It's a sign that the treatment is working and should be continued with. I have not a problem with that. I think in a lot of cases that idea is bullshit, but it does exist. It can be true. So it's tricky. So I'll give you two examples of actual sort of healing crises. One is this one that in the conventional literature has been called the Jarisch-Herxheimer effect. I originally knew it as just the Herxheimer effect, but it's actually called the Jarisch-Herxheimer effect. Where it's sort of this Dr. Jarisch bloke discovered it in the 19th century, and then this Dr. Herxheimer discovered it again in the early 20th century. So they've just squidged their names together. The Jarisch-Herxheimer effect is this literally healing crisis that happens. It's an inflammatory crisis that happens when people are treated with antimicrobial drugs for infections by spirochetes, which is a type of bacteria that cause syphilis, also Lyme disease. And when these bacteria die off in large numbers, their bodies, the dead bacteria, are actually very immunoreactive. The immune system reacts to the body. So having all these dead bacteria suddenly dumped into the lymph when the treatment is begun causes this massive inflammatory response. So the patient typically gets a lot worse before they get better. So that's a really conventional, medically mainstream version of a healing crisis. There have been there, and I also think this is something I've seen a couple of times in treatment as a herbalist. One example turned out quite well, the other not so well, and I'm going to give you details about how those two played out. So one was a treatment of somebody I know very well. This is my mum. Many years. Hi, mum, if you're watching. Many years ago. 20 years ago now or something, and she didn't tell me about it until afterwards. I was giving her some plants for a skin issue that was going on at the time, and I think she told me later that after a couple of days, she started feeling really achy and sort of unwell and fluey, a bit of pain in the right hand side. But because my mum's a sort of medical person, she didn't panic. She sort of toughed it out, didn't tell me until a couple of weeks later. I was like, oh my God. And then, and then a couple of days after that, the skin issue started to clear up. And what was interesting about that is that she told me later on, because I think this was maybe a year or two after I'd graduated as a herbalist. I was quite a baby herbalist at the time. And she told me that the same feeling of illness and the pain under the sort of right ribs was like when she'd been a kid and had hepatitis as a child, like the infectious type that you get from food. It felt like a milder version of the same thing. And that was interesting because in the prescription there were a couple of herbs in the prescription which acted on the liver. One was vervain, which I've talked about in a previous live stream. I think there was maybe milk thistle, another couple of livery things. So I suspect, I don't know exactly, but I suspect that what that prescription was doing by really stimulating liver metabolism and also simultaneously slightly activating the immune system, if there'd been any residual hepatitis, I don't see how there could have been years later, but it seemed to actually, I mean, dig it up. It's almost like peeling a layer off the onion, because that crisis, that 2 days of discomfort, was immediately followed by great improvement. Now, obviously, we don't have blood test results to show whether there was any little flare of the liver enzymes or what was going on biochemically. Certainly, there was nothing in that prescription that could have been liver toxic, and the end result of continuing to take the prescription was good. So that was a genuine healing crisis. The other one that didn't turn out so well was about maybe 15 years ago now. And this was a client I saw when I was working in Neal's Yard in central London. And they'd come in and they were getting ready for their wedding and they were super stressed. And I think, again, I think it was a skin condition. I can't remember. But I do remember what I put in the prescription, and there was a couple of lymphatic herbs. These are herbs which in herbal medicine we say move the lymph. Really what they might be doing is stimulating the immune system a little bit and acting as a diuretic. This particular prescription contained cleavers or gallium aperine, which is a brilliant lymphatic. It really sort of, I use it a lot of the time in clients or patients who have chronic tonsillitis or lymph swelling, lymphadenopathy. It won't, and I'll usually use it in combination with other things. And in fact, this prescription contained other things as well. But what happened when I put this person on this prescription was a week or so later, I got a call and they were very upset because they'd come out in shingles, which, if any of you have had it or know someone who's had it, is really horrible. It's a skin condition affecting usually the chest, or that can affect the face, and it's caused by the herpes zoster virus, the same virus that causes herpes varicella zoster, I should say, the same virus that causes chicken pox. And it causes this really sensitive, burning, tingly rash. And it often comes out when you're immunosuppressed, when your immune system is low. So this client was understandably upset, like, what the hell is going on? And I was thinking, what the hell is going on? Because in that prescription, there was, I think there was cleavers, there was a bit of echinacea. So there was stuff to stimulate the immune system and the lymph. Of course, this person was getting ready for their wedding, so there were all kinds of stress. So it may well have simply been that they were very stressed, and that would have brought it out anyway. But my suspicion is that the herbs did, in fact, dig out that shingles. They were activating the lymph. There was probably a little bit of a herpes virus sitting on the backbench in the lymph nodes, just hanging out, just ready to be activated by stress, and just the extra activation of the immune system dug it out. And my suspicion to this day is that had that person continued with the prescription, it would have cleared up, and then there would have been a resolution of the skin problem. But I will never know, because you can't split screen reality. And understandably, this person was quite upset. I did send them a replacement prescription for free, because that's what I do when things go awry. I think that's just good practice to call the patient, find out what's gone on, and then send them a replacement prescription. But I don't think they ever took it, and they never came back. They voted with their feet, which people tend to do if things go wrong. So yeah, that was kind of disappointing, but totally understandable and extremely upsetting for the patient, and incidentally for me as well at the time. So, but I suspect healing crisis therefore is something that can happen. I do think it's a thing. It's just something that I don't really like to try to incite. I don't like to play with it. I think our ancestors in the Middle Ages, and you often see conventional medical types talking about medicine as being medieval, as being it was terrible. And yeah, they did some pretty crazy and unhealthy things. But actually, when you really dig into it, a lot of medieval medicine was incredibly interesting and had some very sophisticated theories. And one of the things they used to do routinely was purge people to get rid of illnesses, to give them laxatives, to make them vomit, occasionally bleeding. That wasn't such a big deal until later on, but that's a topic for another podcast. But they typically give a course of treatment for digesting the humours, as it were. So to prepare somebody for a couple of weeks, for a few days or weeks before doing a purge. So there was this gentle preparative remedy given, and then a purge. And I suspect if some of these remedies were investigated more closely, we would find that there was more merit in them than previously expected, possibly because that digestive phase, the preparative phase, would have enabled the body to take the shock of this purge. And the purge might have had, in whatever direction it was, downwards, upwards, whatever, might in specific instances have had a salutary effect simply by dumping out of the body a lot of extra inflammatory material. Now, I may be wrong about that, but my experience with looking back on medieval and ancient medicine is that it's actually a lot more nuanced and interesting than we are often led to believe. And I will go into that in future live streams, read you some examples of medieval prescriptions and stuff, because it's fascinating. Anyway, just some other thoughts on side effects and healing crises and so on. The sort of like the woo angle, and I like a bit of woo. I'm a herbalist, I'm an astrologer. I think it's useful to frame things a bit magically, but I also think that can be quite useful. The way you look at things can be helpful. So the woo angle is to, if somebody has side effects, after you've done the due diligence thing, after you've worked out what's giving them side effects, advise them to stop taking that medicine and drink lots of water and get it out of their system, and or done what needs to be done to sort of correct them or to address the situation. One thing that might be useful to think about is what is being suppressed or masked or not dealt with by the medicine. In other words, the previous medicine they were taking or treatment, was there anything that was being papered over or not dealt with? Now, this may not always be the case. Sometimes somebody is just allergic to something. Sometimes somebody has just been given the wrong treatment. But if it's kind of one of those bizarre circumstances, one of the B type side effects that keeps us awake at night, if it's one of those and when I say us, I mean herbalists or therapists generally, the unpredictable ones, is there something that was being suppressed? And there may not be, but I think this is always an interesting thing to think about, because one of the phrases that I use a lot, and I think this accords with people like Gabor Mate, who talk about the somatization of trauma, the way trauma can often be expressed physically. One of the phrases that I use too much really is, whatever gets pushed down from the top comes out of the sides, meaning whatever emotional issues have not been dealt with or cognitive issues have not been dealt with will ultimately express themselves somatically, and if that's, or physically, as symptoms, as illnesses. And if that sounds all a bit too hippie for some, I think it's not. It's just, that's literally true. We now know through chronic stress that chronically high cortisol or stress steroids will eventually cause cortisol resistance, will eventually suppress the specific immune system a little bit, and will allow inflammation to creep up, and will lead to physical illness. So but I think it's interesting seeing everybody has different pressure points. Everyone has different stress fracture points. We've all got our different specific weaknesses. And even if you look at it behaviorally, those physical weaknesses or liabilities or tendencies to illness, like one person will always get a chest infection every winter, another person will have chronic athlete's foot, another person will always get sinus problems, another person will get joint issues. Everyone's got their weak points. And you could look at that even just through a purely mechanistic behavioral lens. You could say it's probable that if you analyze the person's behavior in terms of their habits, their diet, their lifestyle, there will be things that may be contributing to that and that could be practically addressed or reversed, or things put in place to help undo those contributing causes. For example, somebody who has neck problems, it turns out that they perhaps always wear a bag over one shoulder, or maybe they play an instrument like a violin or something that relies on them doing their neck that way. So there are sometimes behavioral things, but there can be behavioral issues which are more driven by negative emotional habits, such as compulsive eating, or staying up late and not sleeping, or just not exercising. And this rabbit hole can go pretty deep. So this is not to say that in all cases of side effects, you need to reinvent the wheel or make it deeper than it needs to be. But it is, particularly when this thing seems to have come out the blue, and particularly when it's quite dramatic, and if there seems to be some kind of narrative around the illness, like this person is always ill, or they were about to get better, then this happened. I think it's always interesting to look at that if a client or a patient is willing to go there, not to gaslight the client into saying, this is your fault. No, it's not about that. It's about, is there anything that could be not dealt with that is here? So this is a tricky one, because I'm not a psychotherapist, and this sort of treads on territory that might verge on psychotherapy here, or even be actual psychotherapy. But I do think it's an interesting thing to consider. Yeah, and just on that, and I've got a question. I see that, Tash. I see your question. Where can we learn ancient purges? All right, I'll come to that in a second. I'll do that at the end, Tash, if you don't mind. Yes. Yeah, so just my final thought just on that last one, and this is really esoteric, but there's a book called Feeding Your Demons by Tsultrim Allione. She's a Buddhist lady, a lama, which always makes me think of sort of alpacas and the animals in Peru, but it's not that. Buddhist holy person. And the book is about a practice, and you can Google it and find it. And again, I've put a link in the description box below this video. And this practice is just one way. It's a visualization exercise. So if somebody's having a recurrent issue come up in their life, and you could even use it for something like recurrent drug sensitivities, or the person who is always having reactions to different foods or medicines. Because while I don't think this means you don't look for the physical cause, you absolutely must. You should always find out what physically is going on and address that. I think it's also important to address the psychosomatic, the mental level. And these strike me as very useful exercises. So have a look at that. The visualization, the shorthand version of it, is essentially you sit in a chair, you have an empty chair opposite you, you visualize, sit after relaxing yourself, doing 9 relaxation breaths, you visualize sitting in the opposite chair, the demon that is bothering you, whatever that is. And then you basically ask this demon 3 questions. I can't remember what the questions are. Something like, what do you want from me? What do you need from me? And how will you feel if you get what you need? And then you swap seats. So you sort of become the demon in this little visualization, and then you answer the question. And then you go back to your original seat, And this is the really Buddhist interesting bit of the visualization, and very psychologically interesting part of it, I think, is you imagine your own body dissolving into a nectar of whatever that demon needs, not what it wants, what it needs, and feeding it until it dissolves. So an example might be if you have a demon of something that's bothering you a lot, like maybe you're chronic insomniac. So you create this insomnia demon. You ask it what it wants from you. Maybe what it wants is for you never to sleep again. What it needs from you, needs from you is love. And how will it feed if it gets what it needs? How will it feel if it gets what it needs? It would feel peaceful. So then you dissolve your body into some kind of nectar. This is all visualization. Obviously, you're not literally dissolving your body into a nectar. That would be horrific. You're dissolving your body into some sort of nectar of peace and feeding it that until it disappears. So it all sounds really out there, but it's essentially a meditation and visualization exercise that is can be really interesting, and you're advised to sort of write all of these things down and sort of keep a journal of it when you do these things. So that's a really out there suggestion that I thought I would throw in, because I think when you're dealing with physical stuff, it helps to also look at these things on other levels and do those simultaneously. It's not an either or thing. Just to come about the where can you learn more about ancient purges, I don't have any specific books for you there, Tash, but there's loads in the Wellcome Library in London if you go there. I do have one actually, but it's a Renaissance astrology book. One second, if I can find it. Yeah. So this is called The Astrological Judgment and Practice of Physic by Richard Saunders from 1677. So this is Renaissance. What's great about this, though, is he lists all these different formulas that were in use by doctors at the time for treating different humoral imbalances. So I will do a pod on that if you want me to. I mean, just pop anything in the comments below the video that you want me to cover. Like if you want me to do a video on that, then yeah, I'm quite happy to, because I can rattle on about that for a while. So anyway, right, I think I'll end it there. This has been quite a long one tonight, so thanks for coming, Tash, and others, yeah, see you next time. Thanks, guys. Bye.